I'm looking for something nutritionally that might impact COVID-19 pandemic. I've heard about vitamin D, so I decided to look it up. I found some things that are very interesting, and this paper is published in the International Journal of Infectious Disease. It was March of this year, and these are the investigators here from Chinese Medical Sciences. Here's what they found. COVID-19 positive patients have higher incidence of low vitamin D levels than COVID-19 negative patients. COVID-19 positive patients have lower vitamin D levels than COVID-19 negative patients. Vitamin D supplementation may be beneficial for the prevention and treatment of COVID-19. Formal proof for an effect remains to be determined by randomized controlled trials. This is a meta-analysis. In other words, they're looking at a group of other studies. They looked at in PubMed, Embase, and Cochrane Library to September 25, 2020. And they found a total of 10 articles with 361,934 participants. In the abstract, observational studies suggest that the risk and clinical prognosis of coronavirus are related to low vitamin D status. However, the data are inconsistent. Mortality from COVID-19 is significantly higher in some countries than in others. For example, Spain, Italy, and the United Kingdom have higher mortality rates than the United States and Germany. There's multiple factors that contribute to this difference, including differences in aging, general health, government decisions, and accessibility of healthcare and socioeconomic status. The vitamin D biosynthetic pathway begins with ultraviolet B radiation. So if you use sunscreen, then there's going to be a problem. One needs ultraviolet B radiation on the bare skin exposed to strong sunlight, and that's the primary source, as few foods contain vitamin D. A substantial body of evidence shows that local synthesis of active vitamin D is critical for the immunomodularity role of vitamin D against inflammation and microbes beyond the systemic level of 25 hydroxyvitamin D and bone. Low vitamin D is also regarded as an epidemic and global public health problem, especially in Europe. It is related to increase in infections and non-infectious diseases, especially upper respiratory tract infections. Now, it says here, a substantial body of evidence has clearly linked COVID-19 outcomes with low vitamin D status, but the results from those published to date are conflicting. Two retrospective studies reported independent association between low pre-pandemic 25 OHD levels, that's a measure of hydroxyvitamin D levels, and the subsequent incidence of severity of COVID-19. While an analogous study in UK did not support the potential link between 25 OHD concentration and the risk of severe COVID-19 infection and mortality, so that considering the impact of COVID-19 risk that potentially results from low vitamin D status, several studies have explored this association. However, the results of these studies are conflicting. To clarify these contradictory results and more accurately assess the relationship between low vitamin D status and COVID-19 risk, we performed a meta-analysis of published studies to provide a clinical reference. So they went through PubMed, Embase, and Cochrane Library databases to September 25th, 2020. So this is a deficiency, and this number is an insufficiency. So that's a distinction they use. What's deficient here and what's insufficient. Most studies were conducted in Asia, 5, followed by Europe, 4 in Europe, and 1 in the United States. Most participants were at least 50 years old. And here's the studies in the individual results. In a fixed effect model, showed that vitamin D deficiency or insufficiency was associated with increased risk of COVID-19 infection. Now, here's an interesting point. Is publication bias? Because if someone runs a study and it doesn't work out well, they tend not to publish it. So they apply this Egger's regression asymmetry test, and it indicated a publication bias. The study clearly links the outcomes of COVID-19 with low vitamin D status. The association between low vitamin D status and metabolism, autoimmunity, and infectious diseases has received widespread attention, according to Hollick in 2017. In particular, some studies have highlighted that low vitamin D status may lead to an increased risk of respiratory infection. Chalmers and others found that bronchitis dilated patients with vitamin D deficiency were more likely to be colonized, right? They had bacteria colonies, and have increased respiratory tract inflammation. Mamani and others indicated that low levels of serum 25-hydroxyvitamin D were associated with high incidence of community-acquired pneumonia and the severity of the disease. Dancer demonstrated that survivors with acute respiratory distress syndrome, ARDS, have higher vitamin D levels than non-survivors, suggesting that vitamin D supplementation may have a therapeutic effect. This led to the hypothesis that low vitamin D status might be associated with an increased risk of COVID-19. Indeed, from clinical observations to randomized controlled trials, researchers worldwide are focusing on this issue. Based on available evidence, we conducted this systemic review and found that vitamin D deficiency is associated with increased risk of COVID-19, and then into the active form in the kidneys and organs. COVID-19 broke out in the winter with low sunlight exposure in the northern hemisphere when levels of 25-hydroxyvitamin D are at their nadir. Patients with COVID-19 are required to be isolated or hospitalized after infection. Most participants were over 50 years old, which may be one reason for low vitamin D, and also an imbalanced diet during hospitalization. Cannot obtain sufficient vitamins from food, leading to vitamin D deficiency. This study, though, has some limitations. First, correlation does not equal causation, and whether low vitamin D levels are a cause or consequence of COVID-19 remains uncertain. Caution should be exercised when interpreting these results. Second, there are discrepancies in the number and sample size of the included study. So the conclusion, low serum vitamin D status may be related to increased risk of COVID-19. The work is supported by China National Science and Technology. Let's look at this study published in Diabetes and Metabolic Syndrome Clinical Research and Reviews magazine. And the title of the article is Vitamin D Concentrations and COVID-19 Infection in UK Biobank. So as you would expect, this study is done in the United Kingdom, Glasgow, by the Institute of Health and Well-Being, and these are all the authors. This was printed in April of 2020, and here's the background and claims. They aim to establish whether vitamin D concentration was associated with COVID-19 risk and whether it explained a higher incidence of COVID-19 in Black and South Asian people. UK Biobank recruited about 500,000 participants in this age range 37 to 73 between 2006 and 2010, and they had COVID-19 test results. baseline exposure data, including vitamin D concentration and ethnicity. Complete data were available for 348,598 blood bank participants. Of those, 449 had COVID-19 infections. Vitamin D was associated with COVID-19 infection univariably, that means like 1-to-1, but not after adjustment for co-founders. Let's look into this a little bit deeper. The results were available for 2,724 COVID-19 tests conducted on 1,474 individuals. So of these about 1,500 individuals, they did nearly 3,000 tests on those people. And they had complete data on the vitamin D concentration and covariance, that is race, age, sex, we'll see later. So those covariants were available for 348,598 UK biobank participants. So of those 348,000, 449 had positive COVID-19 test. What happens here? On the next page, there's this table. The characteristic of the population by presence or absence of confirmed COVID-19. So this group here had the COVID-19, and this group here did not. The no COVID-19 group, 449 are the positive, and 348,598 were the rest after subtracting the positive. So you can see they're roughly evenly split by male and female. There was no significant interaction between ethnicity and vitamin D deficiency, and they're giving us 1-to-1 odds, and they're at 95% confidence in those 1-to-1 odds, but they're only 50% probable about that. So there's a 50% chance that that's not true. Here's the odds ratio, the factors associated in a graph form. So you can see the odds ratio of being black and is almost 5 times. And the odds of being male is almost 2. That's a little. But if you're deprived, if you aren't making a lot of money, the more deprived you are, the greater the odds are. And your health, if you're excellent, odds are 1-to-1. Then it goes up to good, to fair, and poor. Your odds increase 2.5-to-1. And this is an interesting thing, is diabetes, if you don't have it, your odds have increased. So our study is the first to assess whether there is an association between blood, vitamin D concentration, and COVID-19 risk. We found no such link, suggesting that measurement of vitamin D would not be useful to assess the risk in clinical practice. Furthermore, they suggest that vitamin D is unlikely to be underlying mechanism for higher risk observed in Black and minority ethnic individuals to provide an effective intervention. Let's look at some other studies. What do you think? Stay tuned for a surprise twist. The Nutrition Journal. Title is Low Vitamin D Levels Do Not Aggravate COVID-19 Risk or Death, and Vitamin D Supplementation Does Not Improve Outcomes in Hospitalized Patients with COVID-19. Now, the conclusion, this is a group of Chinese investigators from the Department of Cardiology, the first hospital of Nanchang in Jinghua, China, the Sun Yat-sen, the Department of Cardiology, the Sun Yat-sen Memorial Hospital of Sun Yat-sen University, Guangzhou, Guangdong, China. They're looking at 11 studies with about 500,000 patients, and they're saying the overall quality of evidence for COVID-19 infection and associated death was very low. In the introduction, they do cite the study that we just covered from the UK Biobank, and they're stating that it showed a non-significant association after adjustment for confounders. They didn't say before adjusting. So let's continue down. Here's how they selected the studies. They went through the records of research database, 643, removed the duplicates. They screened 299 full text articles assessed for eligibility, and then they settled on associated COVID-19 risk and death. There were 11 of those, and the effect of vitamin D supplementation on outcomes. There were 2 of those. So they included 13 studies. Of the 13 studies, 10 studies, number 3, 5, 12, 15, 17 through 19, and 22, were based on hospitalized patients. Most of the studies were performed in the U.S. We're going to look at those real quick. These studies that performed in the U.S. These studies were conducted in Europe, while one study was done in Asia. They do notice that the publication was biased because the studies were limited to less than 10. So in the discussion, showed that vitamin D deficiency or insufficiency was not associated with a significantly increased risk of COVID-19 infection or in-hospital death. 50-50 chance that what they're saying is correct, the probability of 0.56. Overall, our study suggests no significant association between vitamin D level, COVID-19 infection, and outcomes, and no benefit of vitamin D supplementation in hospitalized patients with COVID-19. Comparison with previous studies. Well, again, they cite the findings of UK Biobank, which found a positive association between low vitamin D and infection, but the association was not significant after adjusting for confounders. We're going to look at these papers that Chin in Nutritional Journal included in his studies. And he's saying most studies, these are the citations, 3, 4, 18 through 20, and 22, number in 6 were performed in the U.S. While these 5 studies were conducted in Europe, this one, 17 in Asia, and 12 was performed in Australia. So let's look at the U.S. study, these studies here. So if I click on 3, it takes us down here to Meltzer, Association of Vitamin D Status and Other Clinical Characteristics with COVID-19, Journal of American Medical Association. So we'll look at that. It just so happens to be right here, Meltzer study. And in Journal of American Medical Association, which is one of the top 5 medical journals in the world. I'll back that assertion up later. Here we go. Association of vitamin D levels, race, ethnicity, and clinical characteristics with COVID-19 test results. David Meltzer and others. So here's a set of numbers that will keep coming up, and you'll probably recognize them after they come up for about the 3rd time. Deficiency in vitamin D is less than 20 nanograms per milliliter, and insufficiency is from 20 to 30 nanograms per milliliter. If you're over 30 nanograms per milliliter, you're not deficient or insufficient. So vitamin D levels are more common in black individuals than white individuals, and are associated with increased coronavirus disease 2019 COVID-19 risk. Whether COVID-19 risk is associated with differences in vitamin D levels of 30 nanograms per milliliter or greater is not known. This study is done in March 2021. The objective is to determine whether COVID-19 test results are associated with differences in vitamin D levels of 30 nanograms per milliliter or greater, including for white individuals and for black individuals. This was a group of people that was conducted at the Academic Medical Center in Chicago, Illinois. And they looked at this group of people that were there. Participants included were individuals with data vitamin D levels 365 days before COVID testing, which was conducted from March 3rd to December 30th, 2020. And the data were analyzed from September 11th to February 5th, 2021. Treatment was defined by vitamin D type and dose 14 days before COVID testing. So there were 4,638 individuals. They used data from the electronic health records from the University of Chicago in Chicago, Illinois, to determine the likelihood of a positive COVID-19 test, to examine whether the likelihood of a positive COVID-19 test was associated, to examine whether the likelihood of a positive COVID-19 test was associated a person's most recent vitamin D level within 365 days before COVID-19 testing, and whether such associations were present for white individuals and for black individuals. Strengthening the reporting of observational studies in epidemiology, reporting guidelines for cohort studies. This study followed the strengthening and reporting of observational studies in epidemiology, reporting guidelines for cohort studies. Look at the characteristics of the sample. This is the age, the sex, the race, whether or not vitamin D dosage changed, when the most recent test was, the time of the test, comorbidity, whether they had high blood pressure, immunosuppression, diabetes, renal failure, COPD, depression, liver disease, psychosis, pulmonary circulation disorder, dementia. Then they looked at their body mass index and their treatment levels of vitamin D. This findings of this cohort study reinforce prior findings by ourselves and others. That's 3 papers they're citing that lower vitamin D levels, for example, less than 20 nanograms per milliliter, are associated with increased risk of having test results positive for COVID-19, and provides evidence that COVID-19 risk is also increased for Black individuals with a vitamin D level of 30 to less than 40, compared with individuals with a vitamin D level of 40 nanograms per milliliter or greater. These results increase the urgency to consider whether increased sun exposure or vitamin D supplementation could reduce COVID-19 risk. It is likely that less than 5 to 10% of U.S. adults currently have vitamin D levels greater than 40 nanograms per milliliter. That's what we need. Since our data are limited to the UCM electronic health record, patterns of vitamin D screening, treatment, or COVID-19 testing might have somehow selected for participants in a manner that induced an association between observed vitamin D status and testing for COVID-19. However, studies in many different clinical settings have now reported low vitamin D levels to be associated with increased COVID-19 risk. This was sent for publication in February 2021. 3, 6, 7, 8, and 10. Oh, I looked these up. Vitamin D supplementation to prevent acute respiratory tract infections. Systematic review and meta-analysis of individual participant data. A basic review of preliminary evidence that COVID-19 risk and severity is increased in vitamin D deficiency. Vitamin D sufficiency, the serum, 25 hydroxyvitamin D, at least 30 nanograms per milliliter, reduce risk for adverse clinical outcomes in patients with COVID-19 infection. Association of vitamin D with modulation of disease severity in COVID-19 virus research. Now we'll look at the next study. This is the Rodujkovic's writing in Nutrients about vitamin D deficiency and outcome of COVID-19 patients. It was published in August 2020. He's from the Department of Internal Medicine University of Heidelberg, Germany. So he says, to explore possible associations of vitamin D status with disease severity and survival, we studied 185 patients diagnosed with coronavirus disease 2019, COVID-19, and treated in our center. Primary endpoint for this study was severe course of disease, that is the need for invasive mechanical ventilation and our death, IMV/D. Within a median observation period of 66 days, 23 patients required invasive mechanical ventilation. A total of 28 patients had IMV/D, which included 16 deaths. 50% of patients required hospitalization. That's the inpatient group. A total of 22 patients were vitamin D deficient. Highlights the need for interventional studies on vitamin D supplementation in SARS-CoV-2 infected individuals. Let's see what else is notable. Vitamin D deficiency was defined as serum total of 25-hydroxy-D, vitamin D level, less than 12 nanograms per milliliter. In addition, the cut point of 25 vitamin D less than 20 nanograms per milliliter, reflecting vitamin D insufficiency, was analyzed. So you have deficiency and insufficiency. These are the patient treatment characteristics. What was looked at: the age, the gender, if there's cardiovascular disease, diabetes, kidney disease, lung disease, cancer, any other comorbidities, whether or not vitamin D was supplemented. Here is the distribution of those having certain levels of vitamin D. So their cut point was 20 nanograms per milliliter. So you could see 30%, that 40% were just below, another 50% was a step lower, and between 5 and 10 was 25%. So not very many people had above this cut point of his, and even fewer above the 40 nanograms per milliliter, which is considered having sufficient vitamin D. And here's the inpatient group. 15 nanograms per milliliter and below is 30%, 20%. And those above 40, which would be sufficient, there weren't very many of those. And this is the outpatient group. And below 20 was a 25%, and then 10 to 15, 25% roughly, and between 5 and 10, 10%. So very few of them had vitamin D above 40 nanograms per milliliter. Patient and treatment characteristics and references. Chin, we already covered that. Charoengram, we will cover that briefly. And Merrick, does vitamin D status impact mortality, infection? He doesn't think so. Merrick, 2020 April, medical drug discovery. Our findings suggest that vitamin D deficiency may partly explain geographic variations in the reported cases, implying that supplementation with vitamin D may reduce mortality from this pandemic. However, as commonly suggested in the lay press, high-dose vitamin D appears to have limited role in the treatment of patients with severe COVID-19. The National Heart, Lung, and Blood Institute performed a randomized controlled trial evaluating the role of high dose, single dose. We're going to cover one of those studies. And single high dose does not impact the outcome of the disease. And he's citing that. That's all he has to say. Moving on to the next one, and faster still. This is one of Chin's cited studies from the United States, and this is done. It was published in the journal Clinic, Sao Paulo, and it was published 2021, November 17. And the title is Effect of a Single High-Dose Vitamin D3 on the Length of Hospital Stay of Severely 25-hydroxy vitamin D deficient patients with COVID-19. Murai was the principal investigator. This study gets confused with one that's published in the Journal of American Medical Association. Chin thought this one was, or used Murai's name where it should have been another person's name, which we just looked at in the last study. Double-blinded, randomized, placebo-controlled trial. That means they didn't tell who was given them the vitamin D or the nothing. That was not known by the people who were administering the placebo or the vitamin D. And it was randomized. They're saying they mixed them up. There is a crossover design in which they would switch the groups and withhold 32 patients were included in this study. And the conclusion is 200,000 international units of vitamin D3 did not significantly reduce the length of hospital stay of patients with severe 25-hydroxy vitamin D deficiency and COVID-19. See if there's anything in particular. 237 patients who participated in the randomized control trial. 32 had severe vitamin D deficiency. And 16 on each side, the placebo side and the non-placebo side. Patients with moderate to severe COVID-19 and severe vitamin D deficiency, we showed that a single high dose of 200,000 international units of vitamin D3 resulted in an approximate 4-fold increase of vitamin D levels, but did not significantly reduce the length of hospital stay, mortality, admission to intensive care unit, mechanical ventilation requirement, or other clinical outcomes. The limitations of this study were the small sample size, considering the trial was not planned to evaluate severely vitamin D deficient patients only, and the long time that elapsed from symptom onset to vitamin D3 administration, 8.6 days after the patients developed the symptoms did they get the vitamin D, which could mask potential early benefits evoked by this intervention.